Have you ever experienced losing a loved one because of an overdose or hearing a story because of it? Well, as of 2023, there have been approximately 105,000 deaths in the United States. In my speech, I will be covering what a safe injection site is and what they provide. The safe injection sites, also known as the overdose prevention centers, are important because not only do they help individuals who are currently using drugs, but they also help the environment out as well. According to the Recovery Research Institute, the overdose prevention sites are a type of harm reduction that have been established to not only address the opioid overdose crisis, but to reduce transmission of diseases. With all this being said, I am here to convince you as to why we should vote to keep the overdose prevention centers. To support why we should keep the safe injection sites, I will be including why they keep our environment clean and stable. I will provide statistics as to how many overdoses are prevented because of the sites, and I will be providing the reduction health cost expenses. In the web article GovFacts, published on August 13th of 2025, states that rather than harming public safety, safe injection sites improve it by providing safe collection and disposal of used syringes. These sites protect the environment by having a proper place to dispose of needles, which prevents it from being out in places like the parks where our children play or in sidewalks where we daily take our walks. Now that I've given you an explanation as to how the sites protect the environment, I will be telling you how they help out individuals. According to John Hopkins Bloomberg School of Public Health web article published on August 23rd of 2022, in the year 2021, New York opened the first 2 prevention sites, which in the first 3 months have been able to intervene in 300 overdoses. In addition to this, the health outcomes are positive because there have been no fatal overdoses in or outside the area. Not only does this service continue to provide safety, but it reduces health care costs resulting from trips to the emergency room. The staff from the cost can administer meds such as naloxone, and in addition to this, refer patients towards housing. They also provide mental health support. With having some knowledge as to how the sites reduce healthcare costs, let's dive more into the numbers in connection to this. The National Library of Medicine, an official website of the United States government, analyzes how just one safe injection site can prevent 30 to 84 new HIV cases every year. By preventing HIV infections, it saves millions of dollars because it reduces lifelong treatment, reduces medical expenses, and it pays fewer medical service bills. The success rate of these sites result in 67% fewer ambulance calls. In this speech, we have discussed environmental positive changes that the safe injection sites provide. They save lives and reduce the spread of diseases. They also reduce healthcare costs by preventing HIV and other illnesses. With all this being said, I hope that all of you can see why it's important to keep these sites open. If you or someone ever needs help, remember that there are resources available because one day you or a loved one may need that help. Thank you.